Hi there, this is Corrie Anderson, OBGYN physician at Mercy Hospital in Portland, Maine. This is another installment in the Maine CDC series, Vaccine Answers for Me. We've received many excellent questions about the vaccine as it relates to women's health, fertility, and infertility, and I'm here to address some of those questions. First, let me tell you a little bit about myself. Today, I'm almost 34 weeks pregnant. When the vaccine became available to me as a healthcare worker, I was about 16 weeks pregnant. And I have to admit, I was not without my hesitancy. I took a step back and took a moment to talk to the real experts. I spoke with immunologists, virologists, infectious disease specialists, and maternal fetal medicine doctors. It was very clear to us at that point in time that the risks of symptomatic COVID in pregnancy are high. We know that pregnant women are at increased risk of hospitalization, ICU admission, intubation, death, and things like preterm delivery. For me, the very real and known risks of symptomatic COVID in pregnancy far outweighed any theoretic risks of the vaccine. The mRNA technology has been around for over a decade. The safety and science of it is very well known to the medical and scientific community. So I decided to move forward with receiving both doses of the vaccine. I know that there is a lot of information out there that's hard to wade through. I'm here today to tell you that there is no increased risk of miscarriage, there is no increased risk of infertility, and you cannot shed the virus once you've been vaccinated. These claims are based on a poor understanding of immunology, of vaccines, on scientific analysis, and on genetics. And I'm happy to go into any of those at a further point in time in more detail if people want. Today, we believe that the vaccine is so safe that the American Society for Reproductive Medicine has recommended it for women considering fertility to avoid the adverse outcomes that can happen in pregnancy. Over 50,000 pregnant women have received the vaccine, and we have very good data that shows their pregnancy outcomes do not demonstrate an increased risk of adverse maternal or fetal outcomes. I'd like to encourage you to speak with a trusted medical healthcare provider about whether or not the vaccine is safe for you. Please make this decision based on real scientific information.